Hey, well, it's the top of the hour, so I see we still have some people joining our call. So while they're doing that, maybe I'll just get started. So good morning or good afternoon, I guess, depending on where you're joining us from today. I know we've got people calling from coast to coast, which is terrific. And I think it really shows the tremendous interest in health research that exists across our kidney community. So wherever you're calling from today, we're really glad that you've joined us for this special conversation. My name is Graham Pollock, and I'm with the CanSolve CKD Network. We are a national kidney research network that brings together patients, researchers, healthcare providers, and many others. And we're thrilled to partner with the Kidney Foundation of Canada on this session today and on the exciting new KidneyLink platform that you're going to hear more about a bit later. So I would just like to begin our session by acknowledging that I'm calling today from Vancouver, which is located on the traditional, ancestral, and unceded territories of the Coast Salish peoples, home of the Musqueam, Squamish, and Tsleil-Waututh nations. And I'd also like to acknowledge the territories across this land that all of you are calling in from today. We encourage all Canadians to learn about the Indigenous people of the lands on which they live, work, and visit. And in the spirit of truth and reconciliation, we respect the self-determination of First Nations, Métis, and Inuit, and their rights and responsibilities in cultures, languages, and the pursuit of wellness. So, given the state of my voice this morning, it's a good thing you're not going to be hearing much from me. We have three terrific speakers, and I am so pleased to introduce them to you. They all have very different and amazing perspectives on the world of kidney research. We have Nancy Verdon, who's a patient partner from Red Deer, Alberta. She's involved in a number of kidney research initiatives, and she's going to share some of her experiences and her advice with you today. We've got Melissa Donald from the University of Calgary, who is a researcher, and she's worked extensively with patients and others affected by kidney disease. And she's here today to share some of what she's learned. And finally, we have Leanne Stalker, who's the National Director of Research at the Kidney Foundation of Canada. She's going to be our moderator and will also walk you through some of the ways that you can connect to kidney research. And with that, I'm very pleased to turn things over to Leanne to tell us a bit more about today's conversation. Leanne?
Awesome. Thank you, Graham. So welcome to everybody who's joined us today, and thank you for coming. We're all very excited to be here to, as we refer to, reintroduce you to the new KidneyLink program. We are super excited from the Kidney Foundation of Canada side to collaborate with CanSolve CKD on this fantastic resource, and very excited to share it with everybody today. So for the format of today's presentation, we're going to try to wrap it up in about 20 to 25 minutes and leave lots of time for questions. So please do think about some questions if you have any at the end. We're going to divide the presentation into two main sections. The first is going to be on patient participation or lived experience participation in kidney research. So this part of the presentation is going to be tossed over to Melissa and Nancy to discuss some of their perspectives and experiences, talking about who can get involved, what the roles can look like, what the different roles are and what they look like, and what some of the benefits are, both from the lived experience side as well as the research side. And then we're going to switch gears a little bit, and we're going to talk about getting involved, and we're going to speak exactly about what is being reintroduced on the KidneyLink platform, what type of barriers and misconceptions there are to getting involved, and how the KidneyLink program is going to work. So and then we're going to have a question and answer period, of course. So we're going to move forward. Need the next slide. There we go. And we're going to talk about patient participation in kidney research. And in order to do this, I'm going to hand the microphone over to those in the room that have experience actually doing this to tell you their perspectives about their journey and what they've learned and some of the things that they'd like to pass forward to the audience today. So first we have Nancy. So I'd ask Nancy now to tell us a little bit about her journey and her story.
Well, thank you very much for that. I'm delighted to be here. I have been a patient for 35 years now, so needless to say, my medical history is very long. I will give you a shortened version because I think it really applies to this discussion. So in 1972, at the age of 12, I was diagnosed with proteinuria. And at that time, the message I got from my family doctor was that it was considered weak kidneys and no further discussion, no further referrals, no anything, including follow-up. I never heard about it again. Fast forward to my 18th, 19th year, and I had severe strep throat 2 summers in a row. And 10 years later, I was admitted to hospital with a crash start on hemodialysis without having any prior treatment or experience. And needless to say, it was a real shock and a steep learning curve. Gratefully, here I am today on home hemo and doing really well. I'd like to think that the fact that in 1972 proteinuria was sort of a shrug it off type symptom, and nowadays it's a red flag. So we know that that's a serious concern and it's being treated sooner and more effectively, and we're having much better results. So let's move into, and actually, sorry, when I was diagnosed, I started on PD. The only information I had came from the Kidney Foundation binder, which told me everything there was to know about the modalities. So PD, hemo, transplant, all in one binder. I took that information and decided on PD. The sad part was I didn't have a peer to speak to. I really had no idea what I was getting into. And that was kind of the way it was at the time. So that research that I did, my nurse really wanted me to be involved, and she was the only one I spoke to. So of course, signing the consent and agreeing to be a part of it, but there was no other discussion about what was it like. I believe they were using my blood work to determine that it was effective. I'm guessing because I actually have no idea. The good news is it turned out to be an effective modality, and it continues to this day for those that are on manual. The interesting twist is that in 1988, I asked my nurse, could I go on the cycler because I wanted to go back to work full time? And her comment was, oh, no, that's only for children and babies. And I said, really? And they couldn't, that was the policy, children. Nowadays, we know that's changed as well, although I did find manual PD hugely useful. So what brought me to research? Well, I am a retired OT. I have a very small education in research statistics and proposals and such. What really drew me into research was when I joined one of what was then the Kidney Health SCN in Red Deer, or in Alberta, which was about supporting and improving the quality of care for kidney patients. That also led me to my patient and community engagement researcher, which is a qualitative research certificate, and the doors started to open. And the more people I met that wanted my story and my experience to support their research, the more fascinated I became. The range from bench science to person direct care, meeting these amazing researchers who are curious and dynamic and warm and welcoming and valuing our experience, makes it really hard to say no, because I do get a lot of requests and I really want to be a part of a lot of what's going on. So I've learned a lot about the healthcare system and how it works and maybe doesn't work. I've learned a huge amount about research. More importantly, I've learned about the people that are doing the research, and I enjoy working with them so much because they do welcome my off-the-wall questions, and they do support us, not just me by any means, in being a part of the research projects. The impact I've had is I've been able to see some of those studies come to implementation. And I've had an opportunity to see some of our investigators change their direction. They've changed the way they do their practice. They think differently about how patients can be involved. And it's been worth all those hours and moments and scratching head questions to be involved in research. And I am so grateful and so glad that that's been a part of my journey. And that brought me to KidneyLink, and I'll fill you in on that later. In the meantime, I'll pass it over to Mo to tell the researcher side.
Thanks, Nancy, and thank you for having me share my experience today. So my history is, one, I'm similar to Nancy in terms of I am a clinician, but not a nephrologist, not a nurse. I'm a physiotherapist by training. And why do you think, physiotherapist interested in kidney disease? And I'll tell you a little bit more about that in a moment. But I also have a personal attachment to kidney disease. I am a caregiver to my father, who's 88 years old and is approaching end-stage kidney disease. And a funny thing was that he was diagnosed about 7 years ago when I was just started working in the nephrology group. So interesting enough how your personal life and your professional life can come together. In terms of what motivates me to do the research and do work with patients as patient partners, this started years prior to joining the kidney disease or kidney research portfolio. Was I've always questioned, why don't we improve care for patients? And early stages of my research were in orthopedics, and I questioned, like, why, surgery's improved, our care in the OR is improved, but why aren't we improving care for patients after, like, for example, hip and knee replacements? So I've always questioned, how do we improve care for patients in the delivery system? And so this has driven me to the work I do today in kidney disease. And I've been very fortunate to be able to work with patients like Nancy for the last few years, to be able to help understand what's meaningful for them for research. So since my orthopedic days in research to my current work, it's always been driven by what patients have asked, the questions they ask. So why is care not equitable for kidney disease in Alberta or in Canada? Why are there no supports for patients that are in early stage kidney disease? We're told that we can slow progression, but we don't have any supports to do that. So that's kind of where the work has been driven since I've joined the kidney research world. And how I did get involved initially was many years ago with Dr. Brenda Helmegarn, and it was a project looking at research priorities for patients with kidney disease, non-dialysis, non-transplant. And one of the research areas of interest by patients and those that care for them was, how do we slow progression? How can we support self-management? So I was very fortunate to start working with patient partners in CanSolve about 7 years ago in the initial phases of the projects that were supported by the CIHR. And so what I've learned to date is I've learned a lot, and I continue to learn from our patient partners. And one thing that is key is, to this day, not to make assumptions about what patient partners can and cannot do. And that relates to patient partners' interests, skills, needs. And, we can get that and gather it on paper and go, oh, these people might be interested in this. Patient partners might be interested in that on our team. But having just talking to Nancy even last week on a project that she's on the research team with us on was, why don't you let us do the plain language summary? We can start it. And I always thought, I don't want to burden our patient partners, and as a caregiver and being on other research projects myself as a caregiver, I feel like, I know they're busy. I don't, there's, periods of unwell. I don't want to do that. But listening to Nancy last week, she's like, no, I want it. This is an interest to me to do this activity, to write a plain language summary right from scratch. And I was like, okay. But my impression was, I don't want to burden our patient partners. So interesting enough that, you got to look and ask and inquire. And as Nancy mentioned just now about, she has always lots of questions and suggestions. And as a researcher, it's impressive to hear those, because we then can redirect or change how we do things. And that's what I'm constantly learning from our patient partners. And what has the impact been? To me, the impact has been that what I see as a researcher, like these research outcomes that are important to patients. So, we always, as researchers, look at the traditional outcomes of mortality, hospitalizations, emergency department visits. But have we ever asked what's important to patients as an outcome for them? And for example, specifics around quality of life. So what does our research do to change quality of life for patients? And so a big impact with working with patient partners is redirecting what we look at for outcomes and what are our interventions to achieve those outcomes. And one comment I want to make, I'm not too sure if Dwight Sparks is on the call today, but one comment he made was a few weeks ago at one of our meetings was that it provided him with joy and pride that he went into a clinic and saw the My Kidneys, My Health website poster being advertised there for patients and caregivers. And I guess a clinician said to him, oh, this is great, this self-management website for patients with chronic kidney disease. And he said that he was able to say, hey, I was part of that work. And when I heard that story, it just brought me such joy, because at the end of the day, the work we've done with CanSolve and the work we continue to do is about that driven by patients. Those questions are driven by patients, the outcomes are driven by patients. And at the end of the day, they can see the final products of what the fruit of their time. And I feel like I step back and just, I'm a facilitator, but it's all driven. The work we've been doing with Nancy and other patient partners has been driven by them. So that's the impact, both for me personally, and to just see that joy around what patients are receiving and what they get out of it as a patient partner is so meaningful. So that's my story and why I do research with patients, driven by patients, and why I continue to engage and just love it. Every day brings me more excitement and joy to the work we do. So yeah, I'll pass it back.
Okay, so Nancy, you're muted. So,
Thanks, Leanne. Sorry about that, a little too excited. So this is a really good question. Who can get involved? And this picture is many of the people that are involved in this project and many others. So literally, it's important that we get everyone from patients, donors, recipients, care partners, and family members, that their experiences all matter and all play a part in helping our researchers understand the difference that they're making. And indeed, as Mo has said, what interventions can we use to improve the quality of our life and other aspects that are going on? And that raises the next question, and I'll have the next slide, please. So what do the roles look like? This is a good question because they all are. Many patients are interested, they're eager to be involved. They want to know sort of more about it, and yet they don't have any information on how easily they can be involved and how their range can be our participant, which means they're being a member of the actual study. So doing surveys, doing interviews, focus groups, they can be a part of all this aspect. And it allows our research to collect data so that we have information to make changes. However, that whole range goes from being a part of the study as a participant right through to you can be editing documents, you can participate in the study design, you can go all the way up to writing manuscripts and being co-authors on papers. And the joy behind this is it allows the patient, family members, donors, recipients to work at a level that's comfortable for them. Lots of people are working full time. They may not have the energy. They have other responsibilities. They still want to contribute. And this is the gradient of what's involved. And I speak from experience that with my passion for being involved in this study, I'm currently a co-designer on a proposal that's going in, and that's changed everything for me. This is the first time where my questions and my interest has been valued before the design is completed. So that's being involved at the very, very beginning. I have many friends that are editing documents. I have others that are doing interviews, some that are doing data analysis. It all depends on what you have. Remembering that our patient partners bring more than their lived experience. And this is something that I really want to emphasize, that many of the people that live with kidney disease, they've been everything from doctors and lawyers and engineers to frontline construction workers and electricians, raising families, and don't neglect the requirement of raising a family and managing a household. So every lived experience beyond kidney disease is equally valuable in enhancing the quality of research. And I'll have the next slide, please. So I will speak to our voice and the individual benefits, and I'll let Mo speak to the researcher side. So I think the thing I've experienced the most is when I have something to say, most of the time, and it doesn't always happen, but most of the time, there is silence as I listen to what I have to say, and there may be questions that go with it, which means that people are hearing us. So our voice is now taking on the power to support and direct research and to support and direct the outcomes that go with it. And the interesting thing is I've been a healthcare worker for, well, I'm retired now, and I've been working so hard to change the system over the years, and this is probably the place where I've had the most power and the opportunity to contribute the most to making those changes. The other part that I truly love is learning about the new research and meeting these people who are incredibly creative and curious, and how that research can be relevant to me. Even the bench science side, where lots of investigators, no surprise, assume that, while I'm dealing with cells and molecules and tissue, how am I going to involve the patient? For some of those researchers, they've discovered that being grounded in the patient lived experience actually gives their research new meaning and has helped add to their curiosity and their directive to do more. And I'm going to pass it to Mo to talk about the researcher benefits.
Yeah, thank you, Nancy. For researchers, there's a list here, and there's many more, but the key one for me that I can attest to is these new ideas. So, for example, the self-management work we've done through CanSolve has led to new work that Nancy's also involved in, is understanding integrated care for patients with chronic kidney disease and multimorbidity. These patients, when we look and talk to patients, both as patient partners and as participants in the research, they said, this is great, but, we have multiple providers and we have, multiple different information being provided to us, but, who's coordinating that? How do we have access, equitable access, if we live in remote or rural parts of Canada? And so those new ideas come from the having embedded patient partners to say, hey, you know what, here's another question, here's another idea. So this idea of relevant studies being done in the current environment that we're working in. A second or a third point there is about this the strong funding applications. As Nancy was mentioning, she mentioned about being part of a study right from the beginning, like identifying those methodologies. And as researchers, I initially was a quantitative researcher, and now I'm a proponent of mixed methods. I'm a pragmatic researcher about the methods, and that's based on my exposure to having patient partners and participants that say that, is this the right information we're collecting? Why are we collecting it this way? Why do we have to have a formalized session? Can it be a discussion? We still can collect data that way. So understanding and being open as researchers to new ways of methods of doing research, but then translating those to the funding agencies to build capacity around that we still can do rigorous research using different methodologies. And that clear communication of results, I've been very fortunate to have patient partners in the research that we've been doing to be our key people out there disseminating our research. So being part of conferences, developing those materials for conferences, posters, public and oral presentations for different audiences, making sure those results and outcomes are being communicated to the right groups. If, I look back 10 years ago, where would we be communicating these results and outcomes to? The classic clinical conferences that we attend. Now we have the opportunities to be part of community groups, to go out there where this research is meaningful and those outcomes are meaningful to citizens in the community to do this work. So we're very fortunate as researchers to have patient partners like wanting to take on that role, to be the face for the research, rather than researchers being out there where it's, we're not really champions in the sense to people in the public. So it's great to have that benefit from having patient partners. Thanks.
Okay, thank you so much, Nancy and Mo. That was great. If anybody has any questions about the first part, we'd encourage you to type them into the Q&A box that's just at the bottom of your screen. We're going to move forward to our part 2, which is labeled Getting Involved in Kidney Research. So that's more from the lived experience side. And I think it's also how to involve people in your kidney research from the researcher side. So if we could go to the next slide, please. So there's a lot of barriers and misconceptions about patient partnership and the inclusion of lived experience in research. So as a funder, I know that we are increasing the amount of requirements for having lived experience partners, or the amount of availability for including lived experience partners on grant applications for researchers that do everything from qualitative research right down to basic biomedical bench work. It's becoming more and more commonplace that the expectation is that lived experience voices should be included within these projects, because we've seen the value of their inclusion through projects like CanSolve CKD and all of the wonderful work that the SCORE networks are doing. But it's important to know that even if your project isn't patient focused 100% in terms of it's not a patient oriented project, it still can benefit from having patient or lived experience inclusion. So we've heard a lot of comments and barriers from both sides about how to get this to happen. If you're not already included in a CanSolve, for instance, is a wonderful resource for this. But what if you're not already included or funded by CanSolve? What are some of the issues? So from the lived experience side, a lot of people in the room can probably nod their heads, including Nancy, when we look at some of these barriers of saying, I don't know where to start. This is something very overwhelming for me. I've never been included in research before. I'm not an expert. I'm worried I'll mess something up. We get a lot of comments when we have patients come to review for us. Oh, I'm not a scientist, things like this. So really understanding that you're an expert in your own right and that your experience is your expertise is really important. Not having a lot of time is another thing that people often comment on. As Nancy mentioned a few slides back, we have lots of different ways that lived experience partners can get included. And these ways have a variety of time commitments. So there really is ways to be included that fit within your schedule. From the researcher side, we also get a lot of comments. And as somebody that runs a national research program, I can tell you that I get these comments all the time. The first one is, I don't know where to find patients. So obviously some of our clinical researchers or allied health professionals may have direct access to patients by virtue of what they do for a living. But some of our more basic and biomedical scientists maybe have never spoken to a patient through their entire training career. And this is really a barrier or somewhat insurmountable challenge for them. No experience working for patients. So not only I don't know where to find them, but I don't know how to work with them, which can be quite scary when you're looking at working with a whole new group of people. Funny, because we often hear that researchers are scary from the patient and lived experience side. So just so everyone in the room knows, everybody is scary. Also, my study has limited capacity for patient involvement. So some of these projects might be more difficult to integrate patient voices or patients in them, but there's always innovative strategies and places where patients can be involved. And that brings us to our next slide, which is reintroducing KidneyLink and what KidneyLink does and how we're really hoping as a team that this resource can be helpful to breaking down some of those barriers on both sides and providing support to both lived experience partners and researchers to be able to engage together to better their research. So a lot of people in the room may know KidneyLink was actually launched for the first time a few years ago as a wonderful vision and resource of CanSolve CKD. And it did function quite well in some ways, but it was found to have some barriers to its success. And when CanSolve went through its reiteration into CanSolve 2.0, one of the priorities was noted that we needed to take a look at the KidneyLink program and figure out how we could get it to be more functional and to resonate more with both the patient and the researcher community. So we put together a working group that was composed of both researchers administrators, and lived experience partners, and worked together to look at how we could restructure this resource to be more useful to the community as a whole. And we're hoping that some of these changes will result in a system that has higher uptake and more utilization from the community. So the idea of this platform is to create a space where researchers and lived experience partners can learn about and connect about research that's taking place across Canada. So it's bringing together patients and researchers who want to work together on projects to improve kidney health and the lives of Canadians and those across the world who are dealing with kidney disease. Next slide, please. KidneyLink in its second iteration is a partnership between CanSolve CKD and the Kidney Foundation of Canada. We, from the Kidney Foundation of Canada side, are passionate about continuing to help networks like CanSolve CKD show the research community as a whole the importance of including lived experience in research work beyond just our SPORE networks and really into research as a whole. So this is one of the reasons we're very, very excited as the leading national funder of kidney research specific grants to be involved in this program and to be able to provide this resource to both patients and researchers. Next slide, please. So what can you do on KidneyLink? Please note this is a relatively short presentation, so we do encourage everyone that's here today to go to kidneylink.ca and take a look at what is offered. There's no way in the next 3 slides that I could possibly show you all of the things that this resource does or that's available on this site. So I do encourage everybody to go and take a look. But we're going to focus on some of the very major aspects of the site. The first is on the patient side, as well as on the research side, an ability to search for opportunities that match your interest. So this means if you're a lived experience partner who's never been engaged in research, or maybe who's been engaged in research for years, you now have an opportunity to go and look at what studies are being posted, what type of level of inclusion they're looking for, and to see if any of these might suit your needs or pique your interest. Even if you don't end up getting involved in any of these studies when you go to look at them, it also provides you a good opportunity to know what type of work is happening across Canada and is a good informational resource. So you can see on the right of the screen, we have types of participation, types of diagnoses, any types of treatment. You can actually use filters to look through this information and see what's live posted on the site at any point in time. Next slide, please. From the researcher side, it provides a nice opportunity and a streamlined way to post your studies. This means if you're looking for lived experience inclusion, right back to that barrier, I don't know how to find patients for my study, we've now found a way to help you post your study in a way that patients will have access to it. So you can upload your study to KidneyLink and we'll help connect you to an engaged and knowledgeable community. Now, it's important that researchers take advantage of this opportunity because the more studies that are posted on the site, the more patients are interested in those studies, and then it becomes a bit of a self-fulfilling prophecy. So it is really important that researchers take advantage of this opportunity. From the Kidney Foundation of Canada side, we do often have researchers reach out to us to post studies, but we aren't posting them in a really patient partnership, lived experience centric place. So it's really great that we now have the KidneyLink opportunity, and we're hoping that it'll really centralize all the studies that are going on and looking for participation. If you have any questions as a researcher about patient participation, or you're not sure how to post something on the site, or you're just completely lost, you can always reach out to any members of the CanSolve CKD team or myself, and we would be more than happy to walk you through the process and provide you some guidance. Next slide, please. So this is the next thing that's going to be involved on KidneyLink, which we're very excited about. And this came as a feedback from our lived experience partners and our research participants who say, I participated in the study and then I never found out what happened. I never knew the results. I never saw the papers because they're not combing through the scientific journals. Weird, I know. So the KidneyLink is also providing an opportunity for us to actually come full circle. So these are new studies, they're being posted, they're recruiting lived experience participants perhaps, or partners. And then we're actually going to also be posting the results of some of those studies. So there are going to be plain language summaries. So these are lay summaries of new research by Canadian investigators and teams will be posted each week. So this research may be funded by KFOC or through CanSolve or through other resources, written in language that's accessible for our lived experience community. So again, even if you come to the site and you're not ready to get involved in research yet as a patient, maybe you're interested still in knowing what type of research is happening, and KidneyLink can help you with that too. It can also help researchers to know what is going on in other projects from coast to coast. So the last thing is we've mentioned a lot of barriers and questions, and people feel that they don't have experience integrating patient partnership or patient participants into their work. So the last thing that KidneyLink, or one of the numerous things that KidneyLink is going to do, is also provide a segue for training and support for the basics of patients' engagement and a connection to trusted kidney health information. So this means access to the other wonderful resources that have been developed with a patient-focused lens through CanSolve and through other opportunities as well as a posting of events and education opportunities like this webinar here that we can see on the screenshot to help you become more comfortable working with lived experience partners or more comfortable working with researchers. The idea here really is to bolster the confidence of both of our pools of experts so that they can really learn to work together for the betterment of our community. And we're hoping that KidneyLink will act as a type of linchpin to connect these two groups together and really make sure that we are funding, supporting, and building the best research possible for the best results for Canadians and those worldwide affected by kidney disease. So the last thing you can do is you can stay in the loop by signing up for notifications from KidneyLink if you want. If you do not want notifications, you can just go to the site on your own accord. But if you do and you want to be served a reminder, you can get a weekly newsletter from KidneyLink to tell you what's new. This means new things, new studies that are being posted, new opportunities, and new training opportunities that may have been developed and linked through the site. It also provides you a nice opportunity to post your research study on KidneyLink, etc., and really helps you to know what's going on and stay apprised of all the exciting new work that's happening. So if you'd like to learn more and get involved, we would invite you and welcome you to visit the site. If you have any feedback or questions, we thought it was really important from the working group to tell everybody today that this is an iterative process, right? We launched KidneyLink a couple of years ago. We learned some lessons about how to make it better and have done our best to relaunch it in a way that addresses a lot of those barriers and concerns. But of course, as with all research, we learn as we go and we use data to make things better. So if you do have any feedback about the site or any questions about it, please do not hesitate to reach out. So go and take a look at the site. And yeah, we're really excited to help connect Canadians to kidney research. And we hope that you've learned something from this webinar and that you're excited to give it a try. And I think that's the last slide. So we would encourage everybody to write if you have any questions in the Q&A box. Also, if you, as a researcher or a patient, have any ideas about additional resources or training that should be developed, so places that you could use additional support, that would be another thing to please reach out to us so that we know, so that we can help to develop resources that the community needs to help ensure everybody understands the importance of engaging lived experience within your research. I think I'm throwing it back to Graham.
Thanks so much, Leanne, and thank you to all of our speakers today. I think that was a really wonderful overview of not just the site, but also the whole process and philosophy of patient engagement. And so really, really wonderful that you could share those insights with us. We've had one question come up in the chat. Someone is asking to explain what CanSolve CKD is, and I'd be happy to share a few thoughts, and then maybe Nancy from your side of things, or Mo from the research side, maybe you'd like to add to that. But we're a national research network. We're supported by the Canadian Institutes of Health Research, and our focus is on improving kidney health for all Canadians. And we do that by involving patients directly in designing and executing a number of different research projects that are looking at better ways of diagnosing kidney disease, better ways of treating it, and some innovative ways of providing care that are patient-centered and really emphasize improved quality of life. And so we have 27 different projects across Canada in various stages of completion, and all of them have been developed in partnership with our patients and based on the things that patients were telling us were the most important to them. So hope that's a high-level overview, and if you'd like to learn more, our website is cansolveckd.ca, and there's lots more information there about our individual projects and many of our other initiatives. We have another question saying, can you participate in research that is not in your province? I think the answer is yes. A lot of the studies that we post to KidneyLink are not bound to a specific province. They are open to anybody who is interested. A lot of the surveys and focus groups that are posted there, anybody can join. Sometimes there are specific criteria around your health conditions or your age or certain other factors that that might dictate whether you can get involved, but only in a few instances do we have opportunities that are bound to specific areas, and those will be clearly marked, so you'll understand where the eligibility is for any given study.
Yeah, I think it's important to remember that Canada is it's a very big country geographically, but is quite a small country in terms of population. So it will really depend on the study what they're looking to recruit. But one of the wonderful things that COVID did for us, amongst all the terrible things, is really a building and the value of virtual platforms and virtual communication. So I think a lot more studies have moved to actually being able to have patient partnership that aren't necessarily patients from right next door. And a lot of researchers actually see value in that because they see a value in a variety of experience. They see value in a variety of sort of what maybe the care pathways are, or maybe how they differ, and that can really bring value to their work. So like Graham said, it will be very clearly marked on the study sort of what the criteria are for participation. So if it's Alberta only, it will state very clearly Alberta only, but otherwise it would be open to a lot of people.
Yeah, and I'll follow up on that, Leanne, around the two concepts. So, for example, as a researcher, we have patient partners on our research team that potentially can be from anywhere in Canada, but some studies might ask for patient participants, which means that, as Graham was mentioning, that there might be specific inclusion criteria that state that you have to be in a certain jurisdiction or have a disease process. But that is that is clarified both when the call goes out. But a lot of I can respond to our team that we've had patient partners from the West Coast to the East Coast, and we embrace that for patient partners because, like Leanne said, those perspectives, always keeping in mind that we tailor things potentially to a population or a jurisdiction, but we also know if we think the evidence is strong enough and the effectiveness of the intervention that we want to spread and scale it. And that's where it's important to understand those lived experiences and participants in the research from different jurisdictions.
Absolutely, yeah. We have another question saying for Nancy, how much time is the minimum amount required to participate and who can take the training?
Okay, on the minimum side, that would be participating in a study, and it could be as minimal as 15 minutes to do a survey. And that may be all that's required for that particular study at that time. If you want to go further into it, the training often occurs as you join. So there is some information on CanSolve CKD, and those all have times on them, approximately how much the videos are, etc. And I think they range from about 15 minutes to an hour. And a lot of the training, I can tell you, really is from, again, the next lived experience, which is being a part of research. And depending on what you're involved in, as Leanne said, we do have access to people that you can talk to that can walk you through things and help you out if there's an issue. I hope that answers their question. If not, please let me know. Thank you.
I think for time to just to sort of build on Nancy's answer, even though it was a question specifically for Nancy, I think it really depends on the study, and it really depends on, there was that slide about the levels of inclusion. It could be everything from 1 hour a week for a year to traveling to present at conferences to, a quarterly meeting on a Zoom call. It really just depends on what the study is and what your level of time commitment availability is and what you're getting engaged in. But I think it's really important to mention that all of those levels of engagement are so important. So even if your only availability is to do some studies and participate in some surveys, that is still really valuable. So even though there's a scale of time and inclusion requirement, that scale is not necessarily, it's less to more important. All of those ways that you can participate are really important to the research community. So there's lots of different ways to get involved, all of which can be tailored in a way to what your availability and comfort level is. So it might be, helping with a peer review could be a couple of hours, but once per year, or it could be something spread over the year if you want to be engaged in the study. It just depends on what you're getting involved with. And hopefully KidneyLink can help to show you all of those different opportunities in one place.
That's great. Thanks very much. Another question here, as a patient or donor, what are the steps for proposing a research topic? Do I need an academic supervisor?
So this is an interesting question. Patient-led research is becoming more and more of a thing that is happening. It's still, I would say, in its infancy from the funder side, in terms of we do generally require, at least from our side, we do require an academic lead to be part of the project. But this doesn't preclude you from sharing your interest with the likes of CanSolve CKD or the Kidney Foundation, because we're always connected to the community, and we might be able to connect you to an academic or clinical representative that already works in that space, or might be able to help you develop your idea, which could turn into a co-led project. So that's sort of my perspective on that at this point. Directly patient-led studies are currently a bit of a gray area in terms of funding from a lot of places, but connecting you to a help to be able to do that is definitely something that we can help with. I don't know, Mo, if you have any other feedback on that. Have you had any patient-led ideas? I mean, maybe to help build your work?
Yeah. As I mentioned before, from the self-management work that we have done and currently are doing, this idea of person-centered integrated care for patients with CKD was driven from patients across Canada and their care partners saying there's a gap. And we've been fortunate then to be able to obtain funding to start that work. So it kind of came about from a previous work that led to the current work in terms of patient-led. The points you brought up, Leanne, are consistent, that our systems don't jive yet with funding that's led by patients directly. But it made me think about how we potentially can start thinking outside the box around other granting agencies that are community-based agencies too, that might fund pieces of research that can get it going. So, for example, some agencies that might be locally in your community that might not be kidney related, but support some component that you might be looking to research that is, and then we can kind of write those grants appropriately and be outside the traditional granting agencies. So that's a food for thought now that that question's been brought up.
Well, and another question, this is something that we hear a lot from patient partners. How are patients compensated for their participation in research projects? And it's a question that from the CanSolve CKD perspective, we have pondered many times over the years, and we've actually done a lot of work with our patients and with our research teams on this very question. And we've developed a policy around this that governs how honoraria are paid to patients who take part in research. So we regard patient participation in our projects as absolutely essential. It is absolutely requiring compensation, and we have a framework in place to ensure that there is a monetary remuneration for everyone who takes part in that work. The specifics of that vary a little bit depending on the degree and depth of involvement, but we are very sensitive to the notion that, you know, while people are volunteering their time, they're contributing tremendously to the generation of new ideas and the execution of our projects, and that obviously is, you know, tremendously worthy of compensation. So it's something that we take very seriously. I don't know, Mo, did you have any thoughts from the research team perspective as to how that looks sort of in practice?
Yeah. So locally here in Calgary, when you're part of a CanSolve project, in terms of operationalizing the logistics around that compensation, as Graham mentioned, we do follow the CanSolve guidelines, but how we operationalize that, one is directed by the university and how that remuneration or that compensation occurs. But as a co-lead on our project work, I promote that we talk to each individual patient partner to see how they would like to receive that compensation, how often they want to receive it. So as Leanne mentioned, that you might be part of some work that's over a long term, and it might be monthly versus, you know, a one-time go that you're doing an activity that's for 2 hours. We talk to each of our patient partners individually to address their needs and to be cognizant of how they want to receive the compensation and how often we do that. So try to tailor it because everybody has different needs. And one thing that came to mind when we first started doing patient-oriented research on the compensation is the tax implications for some people that work and the hours they put in. So we're very cognizant of these different needs that patient partners have.
From the funder perspective, it's clearly stated within our guidelines that lived experience partners are to be compensated for their work. So you will see within research grants that often co-applicants cannot be getting salary support from their research grants because they are being paid by their institutions. There is, however, an exception to that rule as it pertains to our lived experience partners. And it is expected that if we see lived experience inclusion as integrated within the work, that it is also reflected within the research program budget. So from the funder side, this is definitely becoming more normalized, and also we're working to make it become more supported, because that is also a barrier that wasn't mentioned earlier from the research side, is that they would love to include patients, but then they have to take money out of other aspects of their research budget. So that's one of the things that the research community in terms of the funding and development side is looking at. How can we catch up, right? Like anything, you start with a system, it's great, it becomes normal, and then you realize that you don't have the pieces in place to support it. And I think that compensation piece is really one of those things that we need to look at in terms of the funding agencies and how we can make sure that we're supporting researchers to be able to support the experts that they're recruiting to their team. So yes, short answer is yes, compensation is provided. Long answer is it may depend on the project, location, and level of commitment.
So much, Leanne. And with that, if there are no further questions, I think we can wrap this session up. I just wanted to say thank you so much again to everyone for joining us today. I know we went a little bit over time, but I think this was a really important discussion that we've had and some great questions that came up. So I really hope everyone enjoyed this conversation, and we'll circle back to everybody who registered with the slides and the recording if you'd like to have this information on hand for your own reference. And with that, I'll just say thank you again to our presenters for their amazing insights and for sharing their time with us today. And thanks again to everybody for coming. Hope you enjoy the rest of your day.